our recent project, we picked patient-centered care. I'm Lindsay, and that's Ashley. I'm sure you guys all know us. But, so yeah, we're going to talk to you about some problems with patient-centered care. So, this is a scenario. A diabetic with multiple admission comes in, and he's 52 years old. He's Hispanic male. He has a history of 2 previous admissions of extremely low blood sugar, and his diagnosis was hypoglycemia, and his current admission is of extremely high blood sugar, and his diagnosis is DKA. So, what would be some things that you would educate to your patient that came in like this? Anybody?
Eat, like diabetes management, like how to manage it better.
Okay. Anybody else?
Diet teaching, what to eat, what not to eat.
Yeah, like an insulin regimen or something like that. Everybody would do that, right? But
So this is the same scenario, but now with better communication. We found out that this patient is homeless, so he can't afford food or insulin. When the patient does find food, there's no insulin to counteract what he ate for lunch. And on days where he can't find food, the patient's sugar drops too low. So now how would you educate your patient? Tracy? Yep. Anyone else want to add anything? Yeah, so you want to do community things that they can do so that they can go get food and insulin as opposed to diet teaching, because it's not diet that's the problem. This guy's homeless and he doesn't have access to food or insulin.
so you want to communicate better. So the problem is that the healthcare teams fail to recognize that the patient is in control and a full partner in providing compassionate and coordinated care. So based on respect for the preferences, values, and needs. So that we need to look out for our patient.
The Joint Commission says it is not only providing information to patients in a manner that they understand, but also allowing the patient to provide information and be part of a two-way conversation. Also, the patient-provider communication can be linked to patient safety. Therefore, it is not only a patient's right to effective communication, but it's also a necessary component of the provision of safe, quality health care. And the project director of health disparities in the Joint Commission, her name is Amy Wilson-Strunks, she stated that communicate with as opposed to provide information to, and this will help the patient with better outcomes, better safety. So to provide effective communication, you need to identify the patient's needs and communicate in a manner that meets these needs. So why does this communication barrier occur? More than 22 million people speak English less than very well. More than 34 million people were born in another country, and more than 95 million have literacy levels below what they need to understand even basic written health information, such as how often to take medicine.
So patient-centered communication is respectful of and responsive to a healthcare user's needs, beliefs, values, and preferences, like I said before. So the problem originates from barriers that block communication, such as limited time to spend with the patient, language, ethnic and belief barriers, and critical care emergencies. So your time is limited with each patient. In the opening scenario, instead of educating about insulin administration and sending our diabetic home, the nurses need to be aware and educated about effective communication with the preferences, values, and beliefs of that certain patient. So your communication skills need to be better. So, according to the study by the Institute for Family-Centered Care, safety is driven by communication. So the study found that patient satisfaction increased from the 10th to 95th percentile. The length of stay decreased 50% in the neurosurgery unit that they did the study in, and there was a reduction in medical error by 62%. And discharges volume increased to 15.5%. They were sending more people home, which was good. The staff vacancy rate went from 7.5 to 0%, and now they have a waiting list of 5 RNs. And there was a positive change in perception of the unit by doctor, staff, and the health staff. So the unit was improving when they used communication.
So it was directly shown that patient safety is effective based on how you communicate with your patients. The diversity in patient backgrounds, preferences, beliefs, values, and situations make it challenging to determine what practices are effective. Therefore, safety family-centered care, providing patient-centered communication has improved the safety of their patients in the neuroscience center. So it was an actual study that was done, and it did show an improvement if you provided like better communication. So some real-life research that proves barriers in communication exist. One hospital did a small research project to see if residents could tell which patients had limited health literacy skills.
And the outcome was that the researchers found that residents were wrong most of the time about overestimating and underestimating patient skills. So they thought like either a patient couldn't do that or they knew more than that, so I don't have to educate them. So, but they were wrong. They didn't know. As long as they like would have communicated with their patient better, they would have known.
In another hospital, a Spanish-speaking physician noticed that the hospital's volunteer interpreters sometimes injected inappropriate personal judgments into their interpretations between the physicians and the patients.
So the patients were receiving inaccurate knowledge and understanding that this leads to problems with quality, safety, and adherence. So they weren't getting the right care by the physician. So according to April Reynolds, research in patient-centered communication is associated with a higher rate of patient satisfaction, adherence to suggested lifestyle changes, and prescribed treatment, and better health outcomes. So some solutions that we thought of to make this problem better was integrate communication initiatives, train staff during monthly orientations. You could watch for communication problems around your unit, recognize the importance of culture, and coordinate interpretation and translation services, and fully translated informed consent forms for like Spanish-speaking patients or patients that don't speak English.
Anyone have any questions about Professor
You know I'm going to have questions. Okay. On that second slide, third slide, I think you've done a good job, but I want to just be careful. On that Family Centered Institute for Family Centered Care,
Yes.
through your research, did you come across why there was just neuro patients and not any other population? Did you come across any other populations in your research?
Let me see which slide.
You can go back to the slide, it'll help you.
This one here?
No. It says Family Centered Care. That's it, Institute for Family Centered Care. And they did a study, you said, on the neurosurgery population. I wondered if you found any other population in your study.
I think maternity, I saw something on maternity
Uh-huh.
and how they like were working together, the families were working together with the doctors, doing rounds together, and it was just based to like people were doing better because the family would catch something that the doctors didn't, or like double medication.
In the neuroscience population, they do more research on families and patients. I'm part of the Institute for Family Patient Centered Care at Health. And the other thing is, what did you all learn about in neurosurgical patients have the highest rate of what? That we talked about, either in critical care, or 499 or 405. Anybody?
That.
DVTs. More patients die when neurosurgical patients have the highest death rate. So they're constantly trying to upgrade their data, communication, families. So they were the first population that instituted coming to codes.
So that can be prevented.
Absolutely. One thing nurses are doing. And the other question I had was, in the Spanish speaking, you know, is majority of people, were they, in your studies and what you found, were they Spanish speaking? Is that what the predominant?
Yes, it was mainly because like also where we are, the U.S. There's so many Spanish-speaking people that mainly all their studies were on Spanish-speaking patients. But I mean, I'm sure there are other cultures out there, but it would be hard to have like a consent form for all the languages. But at least Spanish, you should have at least Spanish. That would be
And what do you think about when you have an interpreter come in? And sometimes in the hospital you have an interpreter come in to explain to the family, and you know a little Spanish, and you know they're, like we have interpreters come in and tell the family the patient's dying. So we know, or we have an ethics meeting, that interpreter is not telling the patient they're very